Well, unfortunately, there's no way I can live up to that. And I really don't look like I belong here anyway. I should be in a talk on, maternal and child health, or the aging demographics of mothers, or, sitting in the audience hearing about how do you get a better work-life balance with small children. So we'll just try and struggle through. As you can imagine, I'm very focused on the future right now, with fear and trepidation and joy. I have a 1-year-old daughter and a baby who's due at Christmas time. And so, as you can imagine, I am very excited, but I'm also very worried. And I worry for them, and I worry for the world they'll live in. Having just been through the election, I worry, will it be a world of civil discourse, or will it be a world of sound bites and short-term fixes? Will it be a safe world? Will it be a fairer world than we live in today? How will societies afford to look after themselves and look after each other? Especially the areas that I'm passionate about, like health and education. I don't know if you saw recently, but new data came out about Australia's health system and health spending. And basically, the health spending's been growing by 8 or 9% a year. And that translates to us spending $60 billion a year more now than we did a decade ago. The key point is that we're not buying lots of new technologies, it's not really expensive drugs, but really it's just there are more people who need more care more often. And that's not a trend that's obviously going to change, and it's clearly not sustainable. So, given my daughter has a 50% chance of living to be 100, how are we going to manage this? What about the other children, like Jonda, that Shushmita talked about? So, as a public health doctor who's worked in business and financing, I've looked not just sort of for hearts and minds, but also let's look at the numbers. So what's going on, what can be done about it? So I'm going to talk to you a little bit about the economics and health economics of the NCD epidemic. Today, NCDs are already costing the world trillions of dollars. Usually trillions is a number you only hear with bailouts, but trillions of dollars in NCD prices. For example, diabetes costs $500 billion a year, just diabetes. NCDs drive healthcare costs up higher. They make people sick, and sick people are less economically productive. And NCDs make people dead, and dead people are particularly not economically productive. So that's the sort of macroeconomic impact. But we've also heard a little bit about some of the microeconomic impact, or how NCDs affect individuals and their families. What we've heard alluded to is that illness can push 100 million people back into poverty every year. So these are people who are just struggling out of it, and they are bankrupted by illness, predominantly NCDs, and return to absolute poverty. As Emmanuel describes, this forces people to make these impossible choices. The choice between buying food or buying medicine. The choice between sending your kid to school or seeing a doctor. And so at the individual and family level, NCDs really are an economic challenge rather than opportunity, by and large. But what people don't necessarily also appreciate is that NCDs are a question of equity, and equity is fundamental for economic development as well. And as Sandro talked about, firstly, NCDs are the biggest problem for the poorest and most vulnerable in our societies. Poor people are more likely to engage in risk factors for NCDs. They're more likely to smoke, paradoxically, and they're more likely to eat high-calorie, highly dense calorie foods that lead to obesity and hence to NCDs. Once poor people have NCDs, well, firstly, they get them at a younger age, and once they have them, they die sooner than people who can afford better health care. And finally, from a sort of maternal health economics perspective, NCDs have an intergenerational effect, so that the children of mothers with NCDs are more likely to develop NCDs themselves when they're adults. And this is this intergenerational effect, or the cycle of poverty that Sandro mentioned. So at the micro level, NCDs are the worst for the poorest and most vulnerable. But at the macro level, they sum up and are a problem for all of us and for all countries, and especially for developing countries. A study from the World Economic Forum and Harvard University looked at what's the impact likely to be of NCDs, looking at the global economy. And they estimate in the next 20 years that NCDs will wipe $47 trillion off the global economy. $20 trillion of that will come from low and middle income countries. And that translates to about $500 billion a year of lost economic potential. Now, $500 billion sounds like a lot. It's not trillions of bailouts, but it's 500 billion. So let's put it in context. What is $500 billion? Well, it's 7 Bill Gateses. It's 2.5 times the number of stars in the Milky Way. And it's 111 times the amount of the foreign aid budget that has recently been postponed by the government. $500 billion a year, $500 billion is enough money to eradicate the $2 a day poverty in which 2.5 billion people live on the planet for 50 years. So $500 billion is actually really worth something. So you'd think that's a big prize. What are countries doing about it? What are they doing to keep their voters happy and healthy? Well, in fact, most countries only dedicate a small proportion of their health budgets to prevention and health promotion. So let's look at Australia as an example. Australia sits about 20th in the world on health prevention spending on a per capita basis. And so for every $100 we spend in the economy overall, about $9.50 goes on health, and of that $9.50, about 16 cents goes on prevention. So 16 cents doesn't seem like a lot. And I think it takes us to the question, how much should we be spending? And here I'm going to turn to the Global Health Authority, the World Health Organization, and they talk about a set of interventions called the best buys. Now, this is because they consider them to be the best value that can really make a difference. Now, they're cost effective. They're deemed to be essentially the bare basics that countries should be doing. And they're things like increasing the taxes on tobacco and alcohol, making indoor spaces smoke-free, increasing health information and making fast food, for example, have fewer of those bad fats, the trans fats. So they're pretty cheap, actually, those sort of structural changes. They're definitely cost-effective, and some of them actually increase the revenues that come back to governments, so that governments could have more money to spend on health programs. Now, the World Health Organization estimates that for the developing world, this would cost about $2 billion a year. So that's about 40 cents a head to get these basic interventions in place. But they've also looked at interventions that can be delivered not just at the population or systems level, but that should be delivered at the individual level and can still make a big difference. These are things like low-cost generic aspirin for people who are having a heart attack. They're like the screening for cervical cancer, so that women have once in their life a screening to prevent them dying from cervical cancer. These are slightly more expensive because they involve the individual contact, but they're still deemed cost-effective, very cost-effective, in other words, value for money. Now, the total bill for this package of interventions is actually $11 billion, which is a lot from most health professionals' perspective. But it translates to being about $1 per person in the poorest countries, or about $3 per person per year in the upper middle income countries. So again, WHO is arguing that it's affordable. So $13 billion, sort of big numbers, but again, remembering offsetting that against a bill of $500 billion. If we spent this $13 billion, what would we be buying? Well, in health terms, we're looking at preventing premature death. We're talking millions of premature deaths. So for doctors, this is a laudable sort of undertaking. In health economic terms, even in the richer countries, these are cost-effective investments. Okay, so they're not just a cost, they're actually something you're doing for a return. Essentially offsetting $500 billion of a bill with $11 billion of an investment, $13 billion of an investment. Let's just look at that in practice in Australia. And if you look at the Australian National Preventive Health Agency, their estimates are that every dollar invested in Australia gives at least a $2 return in our rich country. So we're talking about our future, children's future, our country's future, our economy's future. And here I'd just like to look at tobacco as an example. Because, as mentioned, Australia has been a world leader in tobacco. Between 1974 and 1995, the proportion of Australian men who smoked dropped by 40%, and the number of women who smoked dropped by about 25%. And today, those numbers have roughly halved again. Now, the investment from the government to achieve that was about $200 million. Applied Economics submitted a report to them that estimated actually the health costs averted were twice that. But when they went and looked at the wider social benefits from people being healthier and more productive and involved in the community, they saw a social benefit or a social dividend of $8.5 billion. So economists, they make good numbers, spreadsheets. But so let's just use a simple number, like $2 billion. Even if you compare $2 billion for the $200 million the government put in, it's a 10-fold return on investment. So that's a good, you'd invest in that. Imagine if that were applied to the world's 1 billion smokers. And that's what we're playing for. So even a pregnant brain, Sandro, can figure out that the double negatives in the title of this talk, we can't afford not to invest, is actually accurate. And the former Minister of Health, Nicola Roxon, went further, and she said by not acting, we're actively killing people. So in conclusion, I'd just like to say from a doctor's point of view, this is a massive opportunity. It's an inspiring opportunity if you're a med student or a doctor to make an enormous difference. At a time when people are living healthier, longer lives than ever before, we can take that to the next increment. From a health economist's point of view, the challenge is that the longer you wait, the bigger the total bill's going to be. In other words, there's an opportunity cost of not acting. So you have this prospect of an investment or this opportunity cost that looms ahead. And then from a mother's point of view, I see a chance for us to be a lot smarter in how we spend our money so that eventually there's enough to go around. And that means that my kids will have the care that they need, but hopefully all the other kids in the world can too. So thank you for that, and if anyone has any tips on how to manage 2 kids under the age of 2, come see me at the break.